Hi, my name is Emily McGrath, and I am here to talk to you about childhood and adolescent obesity. So, childhood and adolescent obesity continue to escalate in prevalence, becoming a global public health crisis, predisposing our youth to adulthood diseases such as diabetes, hypertension, kidney disease, and respiratory issues. Between 2017 and 2020, the CDC identified a prevalence of 19.7% of children between the ages of 2 and 19 being classified as obese. That is roughly 14.7 million children. So, what is obesity? Obesity can be defined simply as an imbalance between caloric intake and caloric expenditure. In other words, consuming more calories than you are burning off through physical activity. For children, it is identified as a BMI at or greater than the sex and age specific 95th percentile. Common factors associated with childhood obesity include medications, social settings, socioeconomics, psychologic and biologic factors, and family involvement. It is commonly known that children are dependent on their parents for a majority of things in their life, including food choices and meal preparations. This inspired my curiosity and research into how parental involvement in dietary changes can positively influence the reduction of BMI of children. Spirit of inquiry led to the development of my PICO question and proposed intervention. In patients between the ages of 2 and 19 classified as obese, how does family involvement in dietary changes compared to independent dietary changes affect reduction in BMI within 10 months of implementation? My proposed intervention is simple and flexible, incorporating parental involvement in dietary changes within the household. To be more specific, such things as attending educational classes that could educate the parents on standard nutritional facts that pertain to a healthy weight for children and adolescents and what foods are considered healthy to use into meals. They could also participate in cooking classes that could be provided within their community centers. There is a need for enhanced public awareness and educating regarding risk factors for childhood obesity and the need for lifestyle changes, as evidenced by a study performed by Louis et al. This past year. Further evidence has shown that parental involvement directly impacts childhood obesity because they influence the behavior and decision-making of their children. A study conducted in 2020 by Kim and Lee further demonstrated that in their systematic review that family-based weight management interventions can reduce childhood obesity in low-income families. 4 of the 7 studies that they analyzed showed a reduction in BMI of children, and while they are considered inconclusive, the knowledge gained can be incorporated into future research. My intervention begins with a motivational interview with both the parents and the child, separately and together to identify barriers, both from the perspective of the child and then as a household. This will allow for selection of certain interventions that are tailored to the specific needs of the family. A study conducted by Myers et al. In 2018 showed in their results that interventions that were tailored to individual family needs resulted in more positive, healthy behaviors. In addition to simply involving parents into dietary alterations, it is equally as important for them to involve the children as well. I propose that parents involve them in the food selection process and meal preparations. Part of my intervention is also to provide educational material with nutritional facts, including portion sizes, and a list of healthy ingredient alternatives and snack options that will guide them in food selection. This will also encourage more home-cooked meals versus going out to eat, which can become a problem if the family identifies time management as a problem. After the motivational interview is complete, obstacles have been identified, and an educational session has taken place, the family will be asked to identify 2 interventions that suit their lifestyle to partake in. It could be eating in instead of eating out, meals cooked together, healthier alternatives for ingredients, limiting snack times or providing more healthy options for snacks, or reducing portion sizes. These can be altered or adjusted throughout the 10-month period based on follow-up discussions and progress reports. In addition to this, there will be a weekly phone call made to the household to discuss progress and areas of improvement. Follow-up appointments will be monthly, and that is where weight and BMI measurements will be taken. This intervention proposal incorporates the health behavior model developed in 1982 by Nola Pender. Pender's objective was to demonstrate the relationship between the individual's choices and behaviors and their interaction with their surrounding environment. Utilizing the health behavior model will provide us with positive resources to use in treatment. For children battling obesity, it would allow the provider to explore specific barriers, such as finances, parental knowledge, or access to healthy foods, within the patient's environment and tailor interventions for treatment. Understanding the effect of one's environment on their behavior can determine the alterations that need to be made. Approaching a weight loss system should be done at the family level, as it positively alters the patient's environment to allow more sustainable, healthy choices. There will be a total of 10 families participating over a total of 10 months. Children need to be between the ages of 2 and 19 and clinically classified as obese per the CDC guidelines, utilizing the BMI for age growth charts. You can see these charts at the bottom of the poster board. Participants will be on a volunteer basis, and informed consent will explain the study, as well as risks and benefits will be distributed. My team will consist of pediatric physicians and nurse practitioners, dietitians, nutritionists, behavioral health specialists, psychologists, community leaders, and of course the meal preparing parents and children. The intervention will begin with the initial patient survey that will be incorporated into the motivational interview that will be regarding barriers, nutritional knowledge, perspectives of obesity, and identification of barriers will take place along with distribution of the packets and brochures with educational material discussed earlier. Interventions will then be selected for each family to partake in at home. Team meetings will be held monthly, usually the day of or directly after the monthly checkup for BMI and weight measurement collection. This is where results will be reported for discussion. The family will also receive weekly house calls, and discussions then will also be reported in the monthly team meetings. The team leader and pediatric providers will be in charge of the phone calls. Final BMI and weight measurements will be taken on week 45, as well as the final meeting when results are collected and analyzed. Results will be determined to be positive or negative based on the CDC's BMI for age growth charts. The timeline for this proposal is depicted in the top right-hand corner for further reference. If results are positive, with a decrease in BMI in at least half of the study participants, the next step would be dissemination with the hope of utilizing this knowledge and incorporating these interventions into the treatment plan in adolescents everywhere. Ideally early in childhood to prevent obesity entirely. The battle against childhood obesity begins with early intervention, embedded with effective education and sustainable life changes on the part of children and adolescents and their families.